So yesterday we discussed POA indicators, HAC and PSI conditions, correct?
Yes, sir.
Yes, sir.
Thank you guys. Today we can start the ICD-10 PCS.
Bro,
So first thing we can discuss what core set of books we need to use in the ICCS exam and what's that use. First, ICD-10 CM. So ICD means International Classification Disease 10th revision clinical modification. This ICD-10 CM book we can use to lead diagnosis codes. Next, CPT, correct procedural terminology. This book we can use to lead outpatient procedures. ICD-10 PCS we can use in inpatient procedures. Okay, so simple. If they done procedure in the outpatient setting, you need to go with CPT codes. If they done procedure in inpatient setting, we can use ICD-10 PCS codes. For the diagnosis disease, either inpatient or outpatient, only use ICD-10 CM codes. Okay? Now, ICD-10 CM codes, 3 to 7 digit codes. So, which means some codes for 3 digits, some 4, 5, 6, 7. So 3 to 7 digit codes, ICD 10 CM codes. CPT, 5 digit numerical codes. Numerical codes. PCS, 7 digit alphanumerical codes. These are the code structures, guys. So, in the procedure note, how we can identify it was an inpatient procedure or outpatient procedure? How you will identify it was an inpatient procedure or outpatient procedure? The given procedure code options, how you eliminate it was an inpatient or outpatient?
In inpatient, there will be discharge
according
summary.
to
No, I'm not asking nothing. The given options, based on the option, if you see the
according
option
to
is
मतलब digit,
or outpatient, how you will decide?
according to digit.
According to the code structure, simple code structure. In the
Yes,
options, they
yes,
given
sir.
5 digit code, it was a CPT, outpatient procedure. In the options, if they given 7 digit, it was a PCS code, inpatient setting. That's it, okay? No need to check anything. Based on the character, code character itself, we can identify it was a outpatient or inpatient. Clear? Huh? Based on the code characters itself, we can identify. Clear now code books, ICD, CPT, PCS. These three books we need to use for the exam. Okay, now we can start how to use PCS book and guidelines first. So we can start with PCS. What is the code structure of PCS?
7-digit alphanumerical.
7-digit alphanumeric. PCS means procedural coding system. Okay, PCS means procedural coding system. These are the 7-digit alpha numerical codes. Okay, remember now. Go to the PCS book. So please note down the 7 characters of the PCS code. These are the 7 characters. We are going to discuss these 7 characters now. The character 1, section. Second character name, body system. Third character name, root operation. Fourth character, body part. Fifth character name, approach. Sixth character name, device. Seventh character, qualifier. In the 7 digit of PCS code, we have a specific meaning for each character. Okay, one character represent their own specificity. So first character they are saying section. Second character represent body system, root operation, body part, approach, device qualifier. In one procedure, we need to identify these all 7 characters. Then only you will get complete code. Okay, well, we need to identify complete code based on these 7 characters. Any doubt? Any doubt? The 7 characters noted.
Yes.
Thank you, guys. Now we can discuss one character. So, and how to find these characters in the book also I will show. I will share the PCS book with you. So once you go for the book, if you see the table of contents, it will starting. Okay, table of contents means index of the book. In what page number, what you will get, they will give clearly here. They will give sections, headings clearly. After ICD 10 PCS table, they will give sections in the bold letter. Medical and surgical, obstetric, placements, administration. These all are sections up to new technology. Okay, these are the sections. So medical and surgical section. What is the first character they given?
Section.
0, right? Medical and surgical they given 0, correct?
Yes.
Yes.
Obstetric related procedure start with which character? Obstetrics.
1 or 2.
One. Only first character was the section. Only we need to tell first character 1. Now, physical rehabilitation and diagnostic cardiology section. First, which section?
2W.
Yes.
Physical rehabilitation and diagnostic cardiology.
Yes.
F section. Okay, only we need to tell the section means one character only we need to tell. So,
Two.
yeah. Administration.
3.
3.
3. So 3. Now come to next. So first character we discuss first. Section. Section means general type of pressures, okay? General type of pressures. Based on the section, we can identify general type of procedure. That procedure was what type of procedure? We can identify. Clear? Huh? General type of procedures comes under section. So here, first what they saying, zero, medical and surgical. Medical and surgical. So medical and surgical means general type of procedures. All surgical related procedures start with zero. So in overall TCS book, 86% of the codes was zero only. 86% of the codes start with zero. Medical and surgical related. Next, one means obstetric, delivery related. Okay, delivery related. Like this, they given section based on that. B, what they say? Imaging. If B section B was imaging, right? Like all the
Yes.
radiology images, CT, X-rays, and start with B series, fluoroscopy, ultrasound. Okay, so B. Like this, they divided the surgeries procedures based on the general type. So now we can start with zero series. Okay, first we can discuss medical and surgical section related. So now whatever we are discussing, that all procedures start with zero. Zero means medical and surgical, correct?
Yes.
Now medical and surgical G, section 0. What is the second character in the PCS code?
Body
This
system.
is system.
Body system.
Body system. So total 31 body systems we have in the second character. Third character root operation, no? Total 31 root operations. Next body part. Next fifth character approach. Total 7 approaches. Different type of approaches. Sixth device, 7 qualifier. Here remember, so we have some fixed values in the 7 characters. Clear? Huh? So first section fixed value 0. Next body systems, 31 body system values are fixed. Then root operation also fixed value. Then this approaches value also fixed. So first character, second character, third character, and fifth character. These are fixed values. Okay. For each system, we have a specific value. 31 values you will get based on the body system. Each body system have a specific value. Each root operation also have specific value. Each approach also have specific value. Okay. For each approach also have specific value. These are fixed numbers. Out of 7-digit code, 4 characters are fixed values. Okay. Based on the body system, you will get fixed value. If they done any procedure, body system same. Like digestive means you will get same value. Respiratory means same value. Clear? Huh? So now we can discuss first body systems. Total how many body systems they documented?
31.
31.
31. So what is the meaning of body system?
Organs, I think so.
Yeah, anatomical systems, correct? Tell me some examples of body systems, whatever you know.
Respiratory system,
Respiratory, digestive,
Respiratory, digestive,
system, skeletal
Cardiovascular
system,
system.
Endocrine
circular
system,
system, circulatory
digestive
system,
system,
Integumentary system.
system,
integumentary, very good.
Nervous system.
Nervous system,
Musculoskeletal system.
musculoskeletal, endocrine.
tree
So
system.
you have idea. Yeah. So thank you. But in inpatient coding, these body systems they divided more elaborately. They divided more elaborately. Total, the body systems has 31 in the inpatient PCS code. Okay. In the PCS code, we'll get 31 body systems. They divided more accurately, more elaborately. So where we need to find these body systems? So comes under table of contents under medical and surgical. Under medical and surgical. What they mentioned? Under medical and surgical, they given the values systems, right?
yes, sir.
Central nervous system,
Yes.
nervous system, heart and great vessels, upper arteries, upper veins, lower veins. Like this, they given up to upper extremities, anatomical regions, lower extremities. Okay? Up to here, total 31 body systems, 0 to Y. These are the body systems, guys. Now, we can discuss one body system and what are the things comes under that body system. So, central nervous system means what are the body parts you will get in central nervous system?
Brain and spinal cord.
Brain and spinal cord.
Spinal cord.
Brain and spinal cord. Next, other than brain and spinal cord, remaining all the nervous system should be peripheral nervous system. Next, heart and great vessels. Note down what are the great vessels. Heart means you know if they done procedure to heart too. Great vessels, note down. Aorta, aorta. Superior vena cava, superior vena cava. Coronary artery, coronary artery. Aorta, superior vena cava, coronary artery. And heart related also too. Now veins and arteries they divided at two systems, correct? Upper arteries, lower arteries, upper veins, lower veins. So they divided arteries and veins as 4 body systems total, correct? Yes or no, guys?
Yes, yes.
Yes, sir.
Here. Now, what is the meaning of arteries? What is the meaning of veins?
Oxygenated
Arteries
blood
means
carry the arteries.
mm,
Oxygenated blood carry the arteries. Veins
veins carry
deoxygenated blood carries.
Arteries
Arteries
carry
carries the
oxygen,
blood from the vein to heart, and veins carries the blood from heart to whole
arteries
body.
carry oxygen, raise blood away from the heart
yes.
to raise
So
the body.
arteries carrying oxygenated blood from heart to a
Raise
body
the-
part. Veins carrying deoxygenated blood from other body parts to heart. Okay.
Yes, sir.
Now they've divided as upper and lower, right? So
Yes,
the
sir.
center point for dividing upper arteries, upper veins, lower veins, diaphragm. Diaphragm was the center point. Diaphragm. The diaphragm was the center point to divide upper arteries and lower arteries, upper veins and lower veins. Where it will be located, diaphragm?
Thoracic
Base,
diaphragm.
base of the lung.
Below the lungs, okay, or base of the lung.
It located in the thoracic cavity.
Yeah. Thoracic. So below the lungs, thoracic area, diaphragm will be located. Okay. Base of lungs. Now, diaphragm above all arteries and veins, upper arteries, upper veins. Diaphragm below all arteries and veins, lower arteries, lower veins. Okay. Now, lymphatic and hemic, like lymph and heme. Heme means blood related. 7. Next, eye related, ear, nose, sinus, respiratory system, mouth and throat, gastrointestinal. See here, there is no digestive system. The digestive body parts comes under the gastrointestinal system. Okay. Remember, digestive related body parts comes under gastrointestinal. There is no separate digestive system. Next, hepatobiliary and pancreas. So note down hepatobiliary means hepatobiliary means
Liver.
Liver.
correct.
Liver
Liver,
related.
gallbladder,
Gallbladder.
biliary tract. So note down hepatobiliary means liver, gallbladder, biliary tract, and pancreas. Okay. Liver, gallbladder, biliary tract, and pancreas. Next, endocrine system. G. Skin and breast. H. Subcutaneous tissue and fascia. Subcutaneous tissue and fascia. J. Muscle. K. Tendon. L. Bursa and ligament. M. So from skin to bursa and ligament. From skin to bursa and ligament. They divided based on the depth. Based on the depth. Clear? So see, if they done procedure on skin level, what is the body part? What is the body system? They done procedure on skin level. What is the body system?
H.
H. Muscle level.
K.
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 If they done tendon level.
Then L.
L, sir.
L. Correct. Next, if they done procedure on bursa and ligaments.
M.
M. M. So simple. Next, see, bones they divided as 3 body systems: upper bones, lower bones, and head and facial bones. Head and facial bones, upper bones, lower bones. Okay. So head and facial bones, you know. Then upper bones and lower bones, what is the center point? Next, upper joint, lower joint, what is the center point? Clear, okay? For bones and joints, what is the center point to divide as upper and lower? Lumbar, okay? Lumbar. Lumbar and above upper bones, upper joints. Lumbar below lower bones, lower joints. Lumbar also upper, lumbar above, and lumbar upper. Lumbar below, lower, like hip joint, knee joint, ankle joint, lower joints. Shoulder, elbow, wrist, upper joints. Okay. Lumbar below, like femur, tibia, fibula, lower bones, like radius, ulna, humerus, vertebral, sternum, clavicular bone. These all are upper bones. Next, urinary system. Note down the midpoint for dividing of upper bones and lower bones, upper joints and lower joints, lumbar. Lumbar. Next, urinary system, female reproductive system, male reproductive system, anatomical regions general. So W, all anatomical general regions will get like abdominal region, cranial region, peritoneal region, thoracic region. If they done procedure on abdomen area, W, thoracic area, thoracic region, W. Next, upper extremities means hands. Lower extremities means
Legs.
Leg.
legs.
Legs.
Legs. Okay, if they done procedure to hands, X. For legs, Y.
Y.
Clear? Huh? No. My question, how you identify the body system in the procedure now? They will do one procedure, but they won't tell the body system, no, I am done the procedure on the particular body system and all. How you identify the body system in the procedure now? These are the body systems. So how you will identify? Tell me, how you will identify in the procedure note body system?
On basis of diagnosis,
Diagnosis based, how you will identify the body system, bro?
if
From organ.
diagnosis is fracture, then we will see what fracture is diagnosed. Hand, leg.
Mm-hmm. How you will,
By
yeah,
body part we
The
can.
alphabetic collector.
yeah.
On the
This is
basis
the
of
procedure, okay?
where it is done.
Yeah, yeah. 1 minute. This is the procedure. Now tell me the body system.
Head. Scalp. Let's see. Bone. Hand.
It might be much.
Femur also is there, sir.
The lower extremity.
Lower extremities
Lower
it is.
extremity bone.
Mhm. It was lower extremity or bone?
Bone.
Lower
Bone.
extremity.
They are clearly saying right
Bone.
femur, right? Then how we will get lower extremity? We have lower bones. Then when you will take lower bones? Now if you take lower extremity, then when you will take lower bones? Option. Tell me. So if they mention bone, bone also a body system. Based on the bone, we need to go with. If it was located in the lower, lower bones, upper bones. Clear? Huh? Now, what is the body system here?
Upper bone.
Femur, where it will be located?
Lower bone.
Lower bone.
Lower bone.
Lower
Thigh,
bone.
right?
Lower.
Yes, lower.
Thigh.
Femur was located in
Thigh
thigh. So
region,
lower,
so
Thigh bone.
lower.
lower bones. Okay, lower bones. Now, how you identified this procedure was body system comes under lower bones based on the body part.
Body region.
Body part, correct?
Okay.
Based on
Femur.
the body part or site of the procedure. Based on the site of the procedure, that site of the procedure location comes under which body system? Based on that, we need to identify the body system. Correct? So here they done femur
Yes.
fracture. So femur was the body part. Body system should be lower bones. If they done esophagus biopsy, esophagus was the body part. Gastrointestinal should be body system. Based on the body part, based on the site of the procedure, location of the procedure, we need to identify the body system. Clear?
Yes. Hello.
Now I will ask some body parts. You need to find the body system. Knee,
Lower.
Lower bone.
Lower
Lower
bone.
bone.
Lower bone.
Lower extremity.
lower.
Extremity.
Joint.
Lower
Lower
bone.
joint.
Lower joint.
Knee was giant.
Lower.
So when remember, guys, do not confuse about extremities. When they are not mentioned, it was bone or joint, then only lower extremities. They simply saying leg, then lower extremity. If they said hand, lower upper extremity. If they saying bone or joint, then you can go with lower bone or lower upper bone or upper joint or lower joint. We need to go with
Okay.
bone or joint specifically if they mentioned. Okay. If they're not mentioned, simply they said hand, then upper extremity. Simply they done leg. If they said simply leg fracture, they not mentioned bone location, then it should be lower extremities. Clear? Here they are
Yes.
saying clearly bone or joint. Then you need to go with more specific body system, bone or joint. So knee comes under
Joint.
Lower
Lower
joint.
joint.
Lower
which
joint.
joint? Here you have two joints, lower and upper. What joint will get?
Lower joint.
Lower joint.
Lower joints. Lower joints. Thyroid gland procedure they've done. What is the body system?
Endocrine.
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 Right. All glands comes under endocrine system.
Hmm.
So if they done thyroid gland procedure, so your procedure start like 0, G. If they done procedure like heart, your procedure start like 0, 2, like this. Okay, clear?
Okay. Yes.
Any doubt in the body system? Simple. Based on the site of the procedure, location of that body part, we need to assume the body system. That body part comes under which body system? That we need to take as body system. Okay. Simple basic anatomical idea. Lungs means which body system, legs means which body system, heart which body system, kidneys which body system. Simple idea. Basic anatomical knowledge. Enough. Next. Second character over. So remember, third character I will explain later. Now listen fourth character. What they are saying? Fourth character, body part. Correct? Fourth character they are saying body part. So body part which means site of the procedure or location of the procedure. Fourth character represents site of the procedure or location of the procedure. Okay, site of the procedure or location of the procedure. Wherever they done procedure, that location will represent fourth character. This is no, there is no fixed values because we have a lot of body parts. No, based on the procedure, we need to find that body part. That's it. Next, fifth character, approach. Fifth character, approach. So tell me what is the meaning of approach? If anyone said you can approach there means what's that approach meaning?
Laparoscopy approach.
Generally,
Site of the
general,
procedure.
no, general approach, okay, not in medical coding. Generally, if anyone asking to approach there, approach here, what is that approach meaning?
Contact anyone, like speak anyone.
Intravenous.
Consulting.
Making a proposal or requesting something.
Simple, at least we can understand what I am saying. If your TL asking, you can approach the HR. That's what's that meaning? It was intravenous. I'm asking just approach means.
Approach,
To,
it's
to reach.
about
Just to
to
meet.
To
deal.
meet.
To
How
meet.
we will go to that site?
Moving towards anything.
Tell me.
To reach a person.
Approach means to reach. Correct?
Move towards.
Tell me, bro. Whatever you are saying, you can tell me, or you can stop.
What type of approach we use it to reach that site?
Yeah, I am not asking in medical coding. Generally, I am asking what is the approach. Why you people are appending to medical coding always? Generally, I am asking what is the meaning of approach.
Generally, approach means making a
Means reaching.
proposal or to request to someone.
Yeah, you can making a approach. If your manager say to meet approach HR means you need to go and meet your HR, correct?
Yes.
Simple. Here also in medical coding also approach means how we are reached to the procedure site. How you are performing the procedure. Okay, how you are reaching the procedure site. How you are approaching that procedure site. Okay, total we have 7 approaches. So based on these 7 approaches, they will use any one approach to reach the procedure site to perform a procedure. They will reach the procedure site to perform a procedure. Total we have 7 approaches. In the PCS book, you will get this approach table. Okay, you will get approach table in the PCS book itself. So this is the approach table. Total 7 approaches we have. We can discuss one approach when we need to take external, open, percutaneous endoscopy, via natural or artificial opening, via natural or artificial opening endoscopy, via natural or artificial opening with percutaneous endoscopic assistance. Total 7 approaches we have. So we can discuss one approach. Before that, you can read these approaches 5 minutes. You can zoom in your mobile, you will get and read all the approaches. And the 5th character value, these are the values, guys. In the 5th character, you will get these values only. These values are fixed. Open approach means always 0 in the 5th character. Percutaneous 3, percutaneous endoscopy 4. These are the fixed values. Read these definitions for each approach and read examples also. Take 5 minute time and read it. Done.
Yes.
10.
Read it.
Yes.
Yes, sir.
Hello.
Yeah.
Yes, right. Now, what they are saying here, first check what approach they given. External. What is the value they given for external?
X.
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 So X. What they are saying external approach means procedure performed on the skin or mucous membrane and procedures performed indirectly by the application of external force through the skin or mucous membrane, which means simple. If they apply any some external pressure and they done procedure also external, or if they done procedure on skin level, external. Skin level procedures. Okay, here they won't cut the skin or other mucous membrane. They will done the procedure on skin level. Suppose if patient have fracture, so fracture we can reduction we can do two types like closed fracture and open fracture. Open means they will cut the skin and other mucous membranes and they will reach the bone and they will fix the bone and they will apply some screws or plates. Sometimes some minor fractures, what they will do, they will apply some external pressure cast like cemented cast or plaster of Paris cast or splint and they will set the bone, correct?
Yes.
Same. If patient have like skin level repair, laceration on the skin, so they will simply suture the skin. The skin was cut, they will simply suture the skin. Okay, if patient have nosebleed, they will put cotton swab or nasal clamp to the nair externally. If patient have electric shock waves, everybody have idea, right? Laser surgeries. So they will send that laser or electric shocks indirectly to the skin and they will do the procedure. If patient have kidney stones, they will apply some electric shock waves and they will do the procedure. And laser surgeries comes under external approach. External means skin level. Okay, skin or other mucous membrane level. That's it. Next, open approach. Open means what they are saying? Not direct, normal procedures. Okay, we can cut the skin or other mucous membranes or other layers, and we need to reach the procedure site and you need to complete the procedure, and again you need to suture that body part. Like suppose the open means they will cut like the skin. Okay, and they will complete the procedure. They will cut and they will complete the procedure. Open. Okay, directly they will cut and they will complete the procedure. After completing the procedure, they will stitch the area. Open. They will open with skin or other mucous membranes. Next, percutaneous means entry by puncture or minor incision of instrumentation through the skin or mucous membrane and any other body layers. necessary to reach the site of the procedure. Here, they will puncture our body through minor incision or through instrument. Like they will create a small hole through instrument and they will complete the procedure. Or they will puncture the body with needle or scalp or blade and complete the procedure. Okay, small hole or puncture. Suppose, tell me how they will transfuse blood for any humans. How the blood will transfuse. I think a lot of people here also they will give donation of blood, no? Through needle, right? They will transfuse the blood through needle. So that needle IV. So that needle they will insert in the peripheral vein and they will transfuse the blood, correct? Huh? Through vein only they will transfuse the blood. Yes or no?
Yes.
Yes. So they will puncture the vein right here. They are puncturing the vein with needle. So it was percutaneous. If they want to remove fluids or gases from the body, how they will remove? They will puncture that area and they will remove that excessive fluids or gases. You seen right thoracentesis in lot of movies also. They will put small hole on the thorax area and they will apply some pressure and they will remove that excessive gas. Okay, excessive gas or fluid form in the thorax area. They will puncture. They will create a small hole and they will remove. All centesis procedures, okay? All centesis, arthrocentesis, thoracentesis, paracentesis, amniocentesis, if they want to remove any fluid or gases, they will puncture and they will remove. Okay, all centesis procedures. Yeah, they will puncture like with needle and they will remove that excess fluid or gases. Like this. Okay, centesis procedures. Then ostomies, tracheostomy. Okay, they will create a small hole. They will incision. They will create a small hole. Okay, needle biopsies. If they done any procedure through needle, if they use the needle to collect the sample, it also considered as percutaneous approach. If they use any needle, percutaneous approach. Here you will get like blood transfusion, incision and drainage abscess, then centesis procedures, or if they insert any catheters with minor puncture, inserting of catheters like a PICC line catheter, pacemaker insertion. If they are inserting catheters to puncture the body, they create a small hole like incision and they will insert the catheters, percutaneous approach. Now, what is the meaning of scopy? Scopy means
Visualization.
yes, visualization. We seen the lot of advertisement also nowadays, no? We are providing laparoscopy procedure, endoscopy procedure. We can discharge in 1 day. Okay, correct. We're seeing this word, right? Endoscopy, laparoscopy, colonoscopy. So scopy means visualization. Okay, scopy means visualization. How they will do this scopy procedures, no? For each scope, we can visualize the site. Okay, for that scopy has a small camera and they will insert that scope in our body and they will visualize the body part and they will complete the procedure. These are the laparoscopic procedures, okay? They will insert the laparoscope and they can watch in the computer and they will complete the procedure. That's it, like this. See here they are inserting and they are watching in the computer that body part and they are completing the procedure. We can visualize the site of the procedure. It was scopy. So now, what is the meaning of percutaneous endoscopy? Percutaneous means entry by puncture or minor incision. So if they create a small hole and they will insert the scope, consider as percutaneous endoscopy. So please note down what are the scopies comes under percutaneous endoscopy. Okay, percutaneous endoscopy, what are the scopies you will get? Arthroscopy, then laparoscopy, main this scopy, okay, laparoscopy, thoracoscopy, thoracoscopy, laparoscopy comes under percutaneous endoscopy. Percutaneous endoscopy. Next, via natural or artificial opening. Tell me some natural routes in our body.
Oral, nasal, rectal.
Yeah, oral, nasal, rectal. Okay. So if they use these natural routes and they will complete the procedure like Foley catheter placement or endotracheal tube intubation, feeding tube, nasogastric tube placement. So they are using natural routes, either mouth, nose, rectum, vagina, penis, and they complete the procedure by a natural or artificial opening. Next, by a natural or artificial opening, endoscopy. Endoscopy means visualization, correct? Scopy means visualization, yes or no?
Yes.
So some
Yes.
scopies here, some scopies they will insert through puncture. Some scopies they will insert through natural routes like through mouth, through rectum. So what are the scopies comes under 8 via natural or artificial opening endoscopy? Check. Colonoscopy, bronchoscopy, esophagogastroduodenoscopy. Colonoscopy, bronchoscopy, esophagogastroduodenoscopy. So if they done procedure by using laparoscopy, arthroscopy, thoracoscopy, 4. If they done procedure by using colonoscopy, bronchoscopy, EGD, 8. Okay, what? So remember this scopies. Which scopy comes under percutaneous endoscopy? Which scopy comes under via natural or artificial opening? Next, simple at last. If you remember or not remember this F character, no problem. You don't get anything in exam also. So F, here they are using two approaches. Two approaches they are using to complete a procedure. Via natural or artificial with percutaneous endoscopic assistance, which means laparoscopic assisted open procedures. Mainly you will get in female reproductive system related procedures. One instrument they will insert through vagina and they will take laparoscopy from abdomen area and they will complete the procedure like removal of fallopian tubes and ovaries, salpingo-oophorectomy and all. Okay?
Sir, you are not audible,
Here
sir.
you will get mostly female reproductive system related procedures. They will use two approaches via natural or artificial opening and percutaneous endoscopic assistance. It should be F. So please check one more time these approaches. If you have any doubt, you can ask me. Please read again. We can discuss again if you have any doubt. Any doubts in approaches? No.
Can you explain the percutaneous endoscopic once again?
Percutaneous endoscopy is simple. If they use any laparoscope, arthroscope, or thoracoscope, it should be percutaneous endoscopy. Scope is they will insert through minor incision. Okay, they will create a small hole and they will insert the scopy and they will complete the procedure. Thoracoscope, laparoscope, arthroscope.
Thank you.
Thank you. Now, sixth character we can start. What is the sixth character? Devices. So tell me anyone, what is the meaning of device? This is open, okay? They will cleave, cut the skin and reach the site. Open. Laparoscopy, colonoscopy, they will insert through rectum. Next, devices. Sixth character, device. Device means device remains in place after the procedure is completed. Okay. Devices are remain in place after completing the procedure. What are the devices we need to consider? Grafts, prosthetic joints. Okay. Prosthesis. Prosthetic joints are graft like bypass graft and all. Then implants, surgical implants. Okay. Then simple or mechanical appliances. Then electric appliances like pacemakers, catheters, okay, defibrillators, prosthetic joint like joint replacements. Nowadays, lot of people doing these joint replacement surgeries, no? Knee replacement, hip replacement, they will replace with prosthetic joints. Okay, graft like bypass graft. Okay, these are considered as device. What we not consider as device, these are we should not consider as device like clips, ligature, suture, and drains. Why? We should not consider these are the device. Why we should not consider clips, ligature, sutures as the device type?
They are not divided.
Because after
Because it
some
will
days
be
they will
removed.
remove. Correct? Sutures after the 5 to 10 days they will remove the sutures. And the clips and they will put for the just uh, holding purpose. Okay? Holding that procedure purpose. Ligatures, drains also. They want to remove any fluid, they will put the drain. After they will remove. So it was not a complete, like it will not remain after the procedure. It was temporary purpose. Okay, these are not considered as devices. Only these things we need to consider as devices. Note down: graft, prosthesis, implants, simple or mechanical appliances, electronic appliances. These are considered only device. Now, seventh character, qualifier. Next, qualifier has a specific meaning for each root operation, which means there is no separate specific meaning for qualifier. There is the qualifier meaning based on the root operation will be vary. For each root operation have a specific meaning for the qualifier. Okay. Now remember guys, we discussed 6 characters except third character root operation. So we done 6 characters. So based on these 6 characters, we can check. What is the meaning of device?
Remains in place. Remaining in place after the procedure is completed.
Remains in place after the completing procedure. Body part, site of the procedure. Approach, how we are approaching to perform a procedure. External,
Procedure.
open, percutaneous endoscopy, via natural or artificial endoscopy. Both like via natural and percutaneous endoscopic assisted. Then body systems. Based on the body part, that body part comes under which body system. Now we discuss section general type of procedures. Now remember guys, we discussed all the body characters except 3. Based on the remaining 6 characters, are you able to identify what exactly they done procedure? Remaining 6 characters are representing what they done procedure?
Yes, no.
No. Where, how we can identify what procedure they done? Just we identify demographic of the procedure up to now. The 6 characters are representing demographic of the procedure. What is the body part of the procedure location? What is the body system? Is what approach they used? They placed any device or not? That's it. But exactly what they done, are we able to identify?
No, the first
No.
is not identified.
Yeah. Now tell me, this is the simple procedure. Okay. We can discuss, are able to tell or not. See, patient was admitted through the emergency department following from ladder while painting the outside of his house. He had a contusion of the scalp, face, and open fracture right femur. So here the fracture was depressed and open reduction with internal fixation was carried out. So here tell me what is the section?
Open.
Section first character.
0.
0. Medical and surgical, correct? This is normal general surgical process. They are doing fracture surgery, correct? 0. Now, what is the body system in this procedure?
Skeletal
Lower bone.
Lower
lower
bones.
bone.
Lower bone.
Lower bones, okay? Lower bones. Now, what is the body part here?
Femur.
Femur.
Right femur.
Femur.
We need to take more elaborately right femur. Then, is there placed any device here? They are placed no internal fixation device. Open reduction. Yeah,
On.
or for the device, open reduction internal fixation device. Okay, they placed internal fixation device. Then they documented any qualifier? No, no qualifier. But based on these characters, are able to find what the done procedure? The
No.
reduction. What they done reduction. Based on the 6 characters, are able to find they done resection, reduction? No, right? Just we seen demographics. Now, third character was the main important in the PCS coding. Okay, up to now, whatever we discussed, these are nothing if you are not able to read the third character guidelines. Okay, so third character should be root operation. Total 31 root operations. Root operation means action and target. Okay, intent or objective of the procedure, like action and target, exact what they done procedure. So total 31 root operations we have in the PCS code. Okay, 31 root operations. We need to learn these 31 root operations, then only possible to get a PCS code. We need to by heart the definitions of the root operations. Okay, these are the more important. So total 31 root operations. So where you will get in the PCS book these root operations? In the table of contents, Appendix A, root operation definitions. Appendix A, root operation definitions. See here they given clearly root operation, value, root operation name and definition. We need to read these 31 root operations before going to the exam. We need to understand because now in exam we can't read definitions and all. Na? We can't apply. So before that itself we need to read and we need to understand the root operation meanings. So guys, here you will get based on the value by 0 to y. First numbers, then letters, 0 to y. But I will explain based on the similarity of each root operation. So these 31 root operations, they divided into 9 groups. Okay, based on the similarity of the root operations. First group was take out some or all of a body part without replacing a body part. take out some or all of your body part without replacing a body part. So take out some or all of your body part without replacing a body part. Clear? So in this root operations, they will remove a body part, complete or partial, based on the different approaches. First, root operation they are saying? Excision. Correct? Excision. What is the value they said for excision? B. Resection. T. T. Now we can discuss these two root operation definitions, excision and resection. Excision means cutting out or off some of a body part. Some of a body part. If they remove a portion of body part, excision. Okay? Note down in excision guideline, the qualifier 7. The qualifier is take diagnostic when they performed biopsy procedure. The procedure was biopsy, qualifier should be diagnostic. Okay, in the 7th character, we need to take diagnostic if they done any biopsy procedure. This thing remember. If any biopsy procedure, 7th character should be diagnostic. Please note down. Now, excision means a portion of removal, partial ectomies. Tell me some examples for portion of removal.
Lumpectomy.
Lumpectomy, if they remove any lump mass.
Appendectomy.
Oh.
Vasectomy, tubectomy.
It was not.
Appendectomy.
Appendectomy was not a complete right. Appendectomy means removal of appendix. It was not a portion of appendix, right? Only portion of removal. Okay, not complete body part. Like partial ectomies. Okay, partial appendectomy, partial cholecystectomy. Okay, then qualifier should be diagnostic. Then biopsy procedures. Biopsy procedures comes under excision. Then debridements. Excisional debridement. Note down. Excisional debridements, lumpectomy or lobectomy. Sorry, not lobectomy, only lumpectomy or mass removal, polyps removal. Okay. One or partial removal of organ, biopsy, debridement, excisional debridements consider as excision. For biopsy, qualifier should be diagnostic. Resection, what they saying? Removal of all of your body part. Correct? Removal of all of your body part or complete lobe. If they remove complete body part or complete lobe, resection. Partial body part or excision. Clear? If any organ completely removed, resection. Partially they remove, excision. Here they won't replace, just they will remove that body part. That's it. They won't replace again. Now I will tell some examples. You need to find the body root operation. Esophagus biopsy.
Excision.
Excision. Laparoscopic cholecystectomy.
Resection.
Resection.
Resection. Resection. Clear? Next. Lumpectomy.
Excision.
Excision. Uh, biopsy,
Excision.
excision. Clear. Any doubt up to now? Whatever we discussed, if you have any doubt. Clear? Okay, guys, now I will give the questions. You can tell me the answer. What is the fifth character represent?
Approach.
Device.
Approach, right? Fifth character was approach, right? Not device.
Yes.
Approach.
Approach. ఇక్కడ చూసి చెప్తున్నారా డివైస్ ఉందనేసి ఇక్కడ చాలా రాంగ్ ఉంటాయి ఇది చాట్ జీపీటీ గైస్ చాట్ జీపీటీ విల్ గివ్ లాట్ ఆఫ్ రాంగ్ ఆన్సర్స్ డోంట్ బ్లైండ్లీ గో రీడ్ థర్డ్ క్యారెక్టర్ represent
Root operation.
Root operation.
Root operation.
root operation. So what character represent approach? Fifth character. Fifth character represent approach.
Approach.
Root operations we don't know. All are root operations. What is the approach in 12th question? Tell me.
Open.
Open zero, right? Fifth character.
Yes, sir.
Yes.
Open. Tell me the which is the part of the code tells you is the digestive system. Which character represent body system?
Second character.
Second character.
Second character.
Open.
Okay. Clear, right? Any doubt?
No, sir.
Okay, guys. That's it for today.